on our website. I'm just admitting one more person here. All right, and then I do want to give Samantha an introduction. So Samantha Kool is a licensed esthetician in the state of Texas. After studying at Aveda Institute of Austin, she went on to complete an advanced certification program in Oncology Esthetics through Oncology Training International. She has been working in aesthetics since 2013 and is a member of the therapist team here at Cancer Rehab and Integrative Medicine in Austin, Texas. Oncology aesthetics is a growing field, and Samantha is committed to ongoing education so she can bring her clients the latest and most innovative treatments in oncology skin care. Welcome, Samantha. We're so appreciative with you sharing your information with us today.
Thank you, Angela. I am thrilled to be here and look forward to chatting with all of these lovely people that have joined us and sharing the information that I have about sensitive and compromised skin and how easy it can be to take care of it. All right, so as Angela had mentioned, kindly, was a lovely introduction. I am a certified oncology esthetician, and I spend my time working with people who are dealing with the effects of cancer and cancer treatment on the skin. It's a pretty specialized kind of niche field. The interesting thing about it, obviously, is that cancer is not the only thing that causes skin to be compromised. There are plenty of other things and reasons why people have compromised and sensitive skin. Just so happens that the oncology space is what I'm passionate about. So a lot of the things we'll talk about today apply to sensitive and compromised skin across the board, and is not limited. They're not limited to the oncology environment exclusively. So I titled my presentation, "Caring for Your Skin During Cancer Doesn't Have to Be Complicated." And as I was thinking more about that topic, I thought, well, it probably would be beneficial to talk about why caring for skin is complicated to begin with, because I think a lot of us probably have the same story. And so I put together some thoughts about what makes taking care of our skin complicated to begin with. And the first thing that came to my mind is that we get no formal training on how to care for our skin. Most of us, we're born, we grew up as young children, and there are so many other things that are important that we are taught to do as far as taking care of ourselves and growing up and being healthy and careful individuals as far as our bodies and our minds, but our skin really sort of gets left behind. So most of us get into young adulthood and we still have had no formal training from anyone about how to take care of our skin. So therefore, we don't know what we're actually working with or what kind of skin we have. So we continue in our lives thinking, oh, well, I better start doing something with my skin. What do I do? Who do I go to? Who do I talk to that can tell me what I should buy and what I should do with those products that I've bought as far as my skin's concerned? The reality is that most of us don't learn that information through the medical professionals or through skincare professionals. We learn that information because perhaps our parents tell us what kind of skin they think we have or that they have, or a little bit about our background. And then we might go to a beauty consultant somewhere who recommends products, or we might go to a pharmacy and ask them what they would recommend for us out of their skincare aisles to put on our face. And so that's really how we sort of enter into the world of skincare for the most part, unless we're very, very lucky. And so we don't know what we're working with. We're not sure what kind of skin we have. We start treating it anyway based on recommendations that we get from folks. And then another piece to that puzzle is we don't actually know how our skin changes over time. So even if you get a correct diagnosis early on, or not diagnosis, rather an analysis of your skin, our skin changes, and it changes throughout the different stages of our life and based on different environmental factors and, genetic factors, medical issues. There's all kinds of reasons that our skin changes, and the care that we give our skin should change accordingly. But if we don't know that information to begin with, if we don't know what we're working with or working from, it's very difficult to know how to change your skincare in order to meet those challenges that can occur as our skin changes. To continue that question of why skincare is complicated, there's an element of who do you trust? Who are you talking to about your skin? What's their agenda? Is it to sell products? Is it to sell services? What's in it for them to give you correct information about your skin, a good skin analysis so that you know what you're working with, and some good advice on how to move forward? What's their agenda? I'll ask that again. That's a question I get as an esthetician a lot. People come in and see me and they're frustrated because they've been to other estheticians or they've talked to other people about skincare products and services, and they tend to get different information. So, sometimes people look at me with an air of distrust as well, as far as, well, what's your agenda? Why is your information better than anybody else's? So that tends to make things complicated. And then lastly, how do we keep up with the ever-changing world of skincare and products? The only word that comes to my mind is it's dizzying. It is the amount of change and the number of products that are introduced, the different types of protocols and services that come out, each one better than the last. It's really, really difficult and overwhelming to try to keep up with all of that and make some sense of it. So all of those things tend to make skincare complicated. And that's before you even get to the sensitive skin part. So if you are like me, and part of my impetus for doing this type of work is the fact that I've always had very sensitive skin. And for me, it's genetic. I just didn't know what to do with it. I knew that I had inherited it, but I didn't know what to do with it. So if you have sensitive skin or sensitized skin, it makes things that much more complicated as far as navigating this dizzying world of skincare and skincare services. So there's an issue that we should discuss, which it's a nuance when it comes to the wording, but it's a very different thing as it relates to these two categories of skin, and it's important. So there's sensitive skin and there's sensitized skin. And easy to interchange those two words and think that they mean exactly the same thing, but they actually don't. So the main difference is we are born with sensitive skin. We acquire sensitized skin. I'll read that again. We are born with sensitive skin, which also means there's nothing we can do about it. We acquire sensitized skin, which means that something happened to cause that and is quite possibly reversible, treatable, something that we can modify our behavior and protocols to address fairly easily. So understanding if you are a person who has sensitive skin or a person who has acquired sensitized skin is also very, very important when it comes to how do you treat it, what do you do. So sensitive skin is more prone to inflammation, reactions to things that we would come into contact with every day, like chemicals and dyes and fragrances, and simple things like friction. Just a little bit of friction can create rashes and inflammation on sensitive skin. Now, what are the causes of sensitized skin? We're talking about things as simple as overloading yourselves with skincare products, pollution that we deal with and are out and about in every single day, alcohol, smoking, stress, medications, health conditions, diet, etc. So sensitized skin as it relates to cancer and the effects of cancer definitely falls in here under medications and health conditions. And it's something that, you know, cancer and cancer treatments are a very common cause of sensitized skin. So the good news is that in a lot of cases, that sensitized skin, when you are done with treatment and in recovery, can return back to the skin that it was before, which makes it less obviously sensitized, much more healthy. There's that possibility. It exists quite often. People will get through their treatments and then realize that all of the things that they were dealing with relating to their skin being sensitive are no longer occurring. Now, there are also situations that I have seen with some of my clients where years later, they're still dealing with certain elements of sensitized skin that came from either their chemotherapy or their radiation or their targeted therapy or from surgery and the trauma to the skin from surgery. So it can go both ways, but usually with sensitized skin, we're talking about skin that can be treated and brought back to, the word is homeostasis, which is a balance. It means a perfect balance of the lipids and the proteins and the fats that make up our skin barrier. So to talk a little bit about the effects of cancer treatment on the skin and how it sensitizes the skin, I just took a couple of the most common treatments that I know that people that come to see me are dealing with or are on. So chemotherapy is obviously one of the big ones. And chemotherapy is a systemic treatment, meaning it goes throughout the body. And so the effects on the skin are also systemic, meaning they can show up and appear anywhere. And it really, there's no rhyme or reason to where they show up. And in a lot of cases, they can seem very, very random. Like somebody could present with a really uncomfortable rash, and that rash might be on the inside of the elbow or inside the arm and the elbow area. So I've had people come into me literally, and they just hold out whatever body part has this horrible rash on it. And they look at me like, this just happened. I don't understand why it's here. There's no rhyme or reason to it. It just popped up. So unfortunately, that's the way some of the effects on the skin present with chemotherapy. It's very tough to tell where they're going to happen, how they're going to happen, and when they're going to happen. Radiation causes localized effects on the skin. So typically where the skin is radiated is where you're going to see your skin reaction. And so radiation, when we think of radiation, we think of most often of burns, of radiation burns. And that's typically what I see when somebody comes in and they're dealing with the effects of radiation on their skin. They're talking about an area that is typically darker in color. The skin can be a little bit more, it's much more dry. It can feel rough. And there's also just kind of some scaling that can occur from the effects of the radiation. But, in most cases, it's localized to the area that's been radiated, as I mentioned. So at least you know what you're dealing with, and you can pretty quickly make the association that is what caused whatever's happening on your skin. Surgery is something that it's a little bit of a different animal, because when you have surgery, obviously it creates a wound. There's some trauma to the skin. Then you've got wound healing that occurs. And there's no mystery to what's happened to your skin where you've had surgery. It's just a matter of understanding, the stages of wound healing and knowing that at a certain point you can affect and treat the sensitive skin once it is healed to a certain point, and understanding how to do that. So what is the goal when caring for sensitized skin? If you have sensitized skin, if you have sensitive skin, people, I think, have a tendency to not realize that less is more. And what I mean by that is we tend to, as humans, it's our nature. If what we're doing is not working, we want to go out and we want to get more products and try more things and do more treatments. And the goal for sensitive and or sensitized skin is completely the opposite. So it requires a kind of a shift in mindset. We're shooting for something that is simple but effective, and we want it to be care that will prepare your skin, protect your skin, and restore your skin. Because cancer treatments, obviously there's a process that the skin goes through when you start having treatment for cancer. And so if you can get, what I have seen is that if you can get ahead of that treatment starting and prepare your skin and make it as supple and as strong and as protected as it can be, the effects of the treatment can oftentimes be much less and much more bearable. So preparing the skin for cancer treatment is also a very, very important step in the process of skincare. And so once you've prepared the skin, and let's just take an example of somebody that's going through radiation for, or getting ready to go through radiation for breast cancer. So as an example, I have a skincare product, which is called My Girl Skin Care, and it's a burn cream, and it is specifically for people that are going to be radiated. And it's a cream that you are actually supposed to be putting on your skin as soon as you understand or learn that that's in your future as far as having radiation. You want to prepare the area, the general area that's going to be radiated by applying this applying this treatment cream once or twice a day to the area that's going to be radiated. You can't over apply it. It's not going to hurt, but at a certain point you don't need more. So, to be realistic, we don't all have all the time in the world to be preparing cream or putting cream on an area all day. So, if we do it twice a day, that's realistic. And that's something that most people can remember to do and is manageable. So for the preparation phase of skincare, if somebody is dealing with radiation or getting ready to, I always recommend that they have a burn cream, a radiation care cream, something specific to preparing the skin for radiation that they apply well in advance of actually starting the treatment itself. As an afterthought on that point, though, with things like radiation, your medical team will tell you it's really important that you not have anything on the skin when you actually go for your treatment. So they will usually give you, and make sure you ask them if they don't, a specific time frame during which they do not want you to apply any product, and that's before treatment and after treatment. So that's just a quick question to ask them if you think about it, but generally speaking, they will let you know. So, you can prepare for radiation. You can certainly prepare for things that are more systemic, like chemotherapy, by simply making sure that you have the right products and that you are hydrating, moisturizing, protecting, and building the rest of the skin on your body before you start having that treatment. And again, getting the barrier function of the skin up to the best possible level it can be before treatment begins. So that's the preparation phase, and it is, to me, just as important as everything else. The protection phase is obviously what you do while you're going through treatment. And, again, it involves having the right products and being consistent and having a plan to work with your skin. But again, we're keeping things simple. So this is not meant to be an 8 or 9 step process where you have to remember what order to put things on, in what order to put things on, and you're going to be doing that multiple times. At most, you're doing the protection phase twice a day. And in a perfect world, you have no more than 3 products that you're working with to keep things simple and to make sure that you can do this continue to do it on a consistent basis and not get overwhelmed. The restoration phase is after you are out of treatment and you are in recovery, or I was going to say between treatment, but no, it would be when you are out of treatment and you are in the restoration phase, and there are a couple of things that are going on during that time. At a certain point, your skin is going to change again. It's going to go back to a certain degree what it was like before you started your treatment, and then there will be some changes that won't they won't go back to, you know, anything other than what they are currently when you get out of treatment, and it'll be a new normal that you're working with. So the restoration phase of taking care of your skin is really going to involve understanding what you're dealing with your skin after your treatment is over and how much of that is going to remain. So are you coming out of treatment with a different texture to your skin? Are you coming out of treatment with a thinner skin perhaps that's more sensitive? Are you coming out of treatment with something that, you know, is a little bit more temperamental, and you've got some sort of combination skin going on that you're working with? So it's all about restoring your skin back to the best possible condition that it can be in, and moving forward using that same protocol after you get out of your treatment phase. And so these are some of the things that we look at when we're talking about repairing the skin or dealing with the skin, addressing the issues that can happen from treatment. Most often, I am talking to and working with people that are dealing with redness, they're dealing with itching, burning skin, there's swelling in areas. A lot of it has to do with inflammation, because inflammation causes so many other problems. So, you know, trying to reduce the redness in your skin, trying to repair the skin barrier so that, again, your proteins and your lipids and your fats that make up that barrier are in balance. You know, trying to take care of the unsightly and uncomfortable things like the itching sensations, the burning, and any swelling that can occur. And, you know, overall, dealing with one of the most important things, again, which is any inflammation that you might have. So these are all goals for taking care of the skin when it's sensitized after treatment. So that sort of begs the question eventually, what about products? What do we do about products? Where do we go? Who do we listen to? You see, I've got a little parentheses down at the bottom, ask for samples. I am a huge, huge proponent of samples. When people come in to see me for skincare services, I like to patch test with everyone just to make sure that the products that I have are not going to cause any reactivity, negative reactivity on the skin. And so before you commit to purchasing new products, if it's a professional product line, they should always have samples available to you. So one of the first things that I'll tell you about products is if and when possible, ask for and get samples and try those before you commit to a whole line or a whole bottle of something. The products that you are looking for to take care of sensitized or sensitive skin. In general terms, you're wanting something that says that it's for sensitive or compromised skin. You want something that's definitely alcohol-free, that's fragrance-free, that has fewer ingredients than more ingredients. Again, it's part of that less is more philosophy that sensitive skin reacts really well to. And, you know, reviews to me are very important. So whenever I look at, sometimes my clients will tell me what they're using. And one of the services that I also offer is to give you an analysis of what your current skincare protocol looks like, because people have spent lots of money on lots of products. And, you know, I'm not the type of person that's here to say, I need you to throw all that away and we're going to start over. What I like to know is what you're working with, and then I look all of those products up and I identify the things in them that may be contraindications to sensitive skin, so that I can at least let you know. And there are lots and lots of things that I don't have listed here, big, long words that are hard to pronounce, that, you know, when you actually look them up and learn what they do and their history, they can cause some pretty consistent sensitivities across the board. So it's important that you know what ingredients are in the products that you're using, It can take some time, but if you can spend some time or have somebody else do it for you that likes to do that sort of thing, that's probably, that would be money and time well spent, in my opinion. So back to products, you're looking for sensitive skin products that say they're for sensitive or compromised skin. You want alcohol-free products. You want fragrance-free products. You want products with as few ingredients as possible, products that have decent or better reviews out there. And then in a little while, we're going to talk about the EWG, which is the Environmental Working Group. That's an extra layer of protection that you can actually check in with when you are looking at purchasing products. And not just skincare, but for your whole life, actually, for your home and things that you would be potentially giving to your children and other family members. It's kind of a great place to go. It's a phenomenal resource for what we purchase and what's in those things that we purchase. So we'll cover that in just a little bit. I certainly have a product line that I use, and today's seminar is not about me pushing my product. So I'm going to spend a little bit of time just talking about the products I do use. They're called Hail and Hush products. They are products for compromised and sensitive skin, and they are currently used in oncology centers around the country. And that last point was really what sort of cinched the deal for me on why I decided to carry that line exclusively, because they're tried and true when it comes to compromised skin, and the proof's in the pudding, if you will. I also have very sensitive skin. I use the entire line on myself and can tell you that I have never worked with such a comprehensive line when it comes to sensitivities. So there are a lot of good product lines out there. You just have to take the time to kind of go through and do your homework so that you know what you're working with and what could potentially happen. A little bit about the point that I make about fewer ingredients. So if you are going through cancer and you're going through treatment and you're using products that cause some sort of reaction that you're not used to, you haven't had before, one of the very first things that you should do is call your medical team and say, this is what's going on with my skin. And one of the first things they're going to ask you is, what have you put on your skin? What products are you using? If they don't already have that information in your file. And it's much easier to decipher and determine what's caused irritation or reactivity if you are using products that have fewer ingredients. So from the standpoint of just doing damage control and being able to react quickly and correctly, it's helpful to stick with really simple products. Not to mention that the fewer products, the less likely you're going to have a reaction to any of the ingredients that are in the products. But that's one of the most important things about the less is more concept during cancer treatment is people that are treating you and taking care of you need to be able to help you identify what might have caused that reaction. So the fewer the ingredients, the better. And that's one of the most important reasons. So we'll go from products to tools. So assuming that you have a product line that you are comfortable with or that you like working with or somebody has recommended to you, you also have tools that you need to take care of your skin. And it's not complicated in any way. It's actually probably the most simple thing that you'll ever do as far as putting a toolkit together for taking care of your skin. But when you have sensitive or sensitized skin, the best tools that you can use on your skin are your hands, believe that or not. So I encourage people whenever possible, anything that you're doing with your skin, use your hands. And if you, for whatever reason, don't want to use your hands and you want to use some sort of, washcloth or loofah or something like that, I would discourage you from using anything that's harsh or in any way abrasive. Use a very soft washcloth. And there are, as an example, there are things called chamois cloths that you may or may not be familiar with that are a very, very different texture. They're very, very gentle. And there are several of them available on Amazon and through different lines like Aveda. But a chamois cloth is a really good alternative to a washcloth. The other thing that I can tell you, which most people probably don't think about, baby washcloths are really excellent also for cleansing and for creating very little drag on the skin. So, use your hands, use a soft cloth, use a chamois cloth, use a baby washcloth. Those are all really good options. What you don't want to do when you're cleansing is use any kind of handheld device when you're sensitive. So a lot of people have Clarisonics, a lot of people have Foreos, different things like that. They're wonderful devices, and when you're not sensitive or dealing with issues, I encourage them and recommend them all day, every day. But when we do have sensitive skin, and that is a thing that we're dealing with, the handheld devices should just be put away and not thought about until things get better with your skin. So using a gentle product line, we've already talked a little bit about that, but that coupled with, using gentle application through your hands or a soft cloth, those two things are probably paramount as far as tools go. But you need to have a product line that you're comfortable with, and whenever possible, use the same products use the same line throughout for all of your products. It's very difficult when people start, taking one product from this line and another product from another line and trying to combine them, because products from the same line are built the same way. So typically they are, in a perfect world, they're what's called chirally correct, which means that all of the molecular makeup of the ingredients in the products, they all play together well. They all make each other more effective. And that's something that you can't necessarily know is going to happen if you're using multiple lines and, just pulling one or two products from each line and putting them together. So I always recommend that you pick one product line whenever possible. The next point I put in there was cryo and cooling options. So, there's all kinds of cryotherapy that's happening today, which I think is amazing because cryotherapy is really beneficial for so many things relating to our health and also to our skin. So it's a fancy name for a really simple thing. As it relates to sensitive skin, what I'm telling you is inflammation, redness, sensitivity, a lot of the things that we talked about earlier. Once you have dressed your skin, in other words, once you've cleansed it and put on whatever products you're going to be putting on, if you have any, there are things called cryo cubes, there are things called cryo wands, there are gel-filled ice balls. There are all kinds of things that allow you to follow up your skincare routine with cryotherapy. So I have some globes. I have cryo globes, and I keep them in my freezer. And after I have done my skincare treatment, especially if I'm feeling a little bit more sensitive than normal, I'll sit down and I'll grab my cryo globes and I will run them over my face for probably 4 to 5 minutes. Obviously focusing, in the areas that I'm having the sensitivity. And if you're not having particular sensitivity, you just use them all over your face and your neck, anywhere that you think you could use a little bit of reduction of inflammation under the skin. And it just feels really good. And it's a very simple way to relieve yourself from any of the sensitivities that may occur from cancer or cancer treatment. So get yourself some cryo cubes, some cryo globes, some cryo wands, anything like that, and pop them in your freezer and just know that anytime you need them, they're there, and 1 to 4 minutes at a time is all you need. And you can do that daily. Mitts for hands and feet. A lot of the people that I have worked with and met have issues with their hands and their feet from their cancer treatment, the effects of their cancer treatment. And so, short of, there's a condition that is hand and foot syndrome. That's a very, very severe condition. And if you have it, if you have had it or you have it currently, you know, my heart goes out to you, because I know that that's an incredibly uncomfortable and unsightly thing to have to deal with. And it can be debilitating just from everyday things that we try to do with our hands and our feet. If you have sensitivities with your hands and your feet that have not yet reached the degree of actually having hand and foot syndrome, you can purchase mitts that you slide your hands into, that you put over your feet, and you can get them in, they can be cooling mitts. You can also have moisturizing mitts. There are things, there are opportunities to do both with the mitts, where you can actually cool and moisturize at the same time. And it's a really nice thing to do, to just be able to kind of sit on the couch, pop your feet up, put the mitts on, and cool or moisturize, or both, your feet, and do the same thing with your hands. Obviously, some considerations when you are dealing with cooling anything, and that is that you just don't want to do it for too terribly long. So I had thrown out 1 to 4 minutes before when I was talking about the face, and I would say the same thing for the hands and the feet. You don't want to leave any kind of ice or cryo care on your hands and feet for longer than, I would say, maybe 3 to 4 minutes actually, and then give yourself a break of about the same time, and then you can go back and start again with the same cooling routine. So very important that, you know, too much of a good thing is not a good thing, that you understand that, especially when it comes to icing. Oh, I had to sneak in a little bit of a self, what is the word I'm looking for? Self promo. I put a good esthetician down there. And what I mean by a good esthetician, obviously, whether that's me or somebody else, or if you have somebody now that you love, an esthetician is a really good go-between between your medical team and yourself, as far as dealing with things that come up on the skin. And I know it can be tough sometimes to know, when do I call my doctor? When would I reach out to my esthetician? Who do I talk to about what's going on? Do I just go to a pharmacy and talk to somebody about something? There's lots of choices, but I am a firm believer. I've always been to estheticians, even prior to becoming an esthetician, that if you have a good relationship with an esthetician, that person can often ward off or help you, help deflect you from certain things that you might be heading towards with your skin. A note on that I think is really important is, you know, I have people that ask me on a regular basis about things going on with their skin. What is happening with my skin? What does this look like to you? An esthetician, in the scope of our license, we are unable to diagnose anything. And so that's one of the hardest parts of being an esthetician, is people often ask, what is this? What has happened to me? You know, what do you see when you look at my skin? We can talk in generalities about conditions of the skin, but we cannot diagnose anything. So as an oncology certified esthetician, people come to see me and a lot of times will say, what is this rash? Or why am I flaking here? Or what is all this localized redness I've got in a particular area? And unfortunately, my response is always the same, which is, I can't diagnose that. That's out of the scope of what I do. So I would highly recommend, if it's something that's new, that you check in with your medical team and at least let them know what's going on, and get them to tell you what the diagnosis is of whatever's happening. If it's a rash, they can tell you what the rash is from. If it's an allergy, if it's just something that's telling you that the medication is actually in fact working that you're on, they can obviously give you that information. And so then you would contact your esthetician if you were going to have a treatment with your esthetician, or just wanted to maybe get some additional products. You can then say, here's what I've recently been diagnosed with as far as my skin goes. What do you have available, or what treatment can you recommend that will reduce the uncomfortableness of this, or the unsightliness of this, or, you know, whatever it is that's bothering you the most about it. So I throw a good esthetician up on the screen, very tongue-in-cheek, but it's a serious point, and I believe in it. So if you have a good esthetician, that's fantastic. If you need a good esthetician, be more than happy to answer any questions that you may have about your skin and what's going on with it. And then in the bottom, in little bitty letters, but repeated over and over and over again, is sunscreen. So sunscreen is, I think something that we have heard about for so long that we're almost numb to it. So people really don't spend a lot of time discussing or thinking about sunscreen beyond the fact that, oh, I better put some sunscreen on. I can tell you that in my world, with what I deal with and the people that I see, sunscreen is one of the most overlooked and underused parts of their skincare routine. So, there's a whole other presentation and topic on the differences between sunscreens. What I can tell you that I know is that the two most important categories of sunscreen, there's physical or mineral sunscreen. Those two are the same. And then there's chemical sunscreens. And for folks that have sensitive skin, it's known that chemical sunscreens can be irritants. And so the recommendation is that if you have sensitive or sensitized skin, that you stick with a mineral-based SPF. Mineral sunscreens are sunscreens that when you apply them to your skin, they create a physical barrier from the sun. So the sun is reflected off them and never actually gets to you. The downside to mineral sunscreens, if there is one, they can tend to be a little bit chalky. They can tend to be, they feel a little bit thicker. They're less easy to apply from the standpoint of the glide on your skin. But the benefits, I think, far outweigh the disadvantages. So the benefits are you get better skin protection for longer, so you don't have to reapply as often. And you're not as prone to react if you have sensitive skin. And chemical sunscreens, one of the reasons why they can cause reactivity is because they actually penetrate into through, I should say, the epidermis of the skin. So they are getting below the top layer of our skin into our body. And so if you don't know 100% about what's in that sunscreen, I mean, my point on that and my thought on that strongly is that you don't necessarily want that getting below the surface of your skin. So physical and mineral sunscreens, which are again the same thing, they do not get below the surface of your skin. They actually sit on the top of your skin and deflect the dangerous rays of the sun. So sunscreen, we'll go back to that. I cannot stress how important it is when your skin is sensitized from cancer or cancer treatment, it becomes phototoxic. Phototoxic basically means less sun equals more burn. You don't want phototoxic skin in the sun without it being protected. So I'm even a proponent of telling people if your skin was sensitive to begin with before you started treatment, sunscreen may not be enough. You can reapply sunscreen several times a day, but in a lot of instances, I recommend that people get sun protectant clothing, sun protectant hats, sun protectant, certainly if you're going to be out in the water, or, sitting out in the sun for any reason, or even outdoors. There are lots of really, really lovely things clothing wise that have come on the market that have UVA and UVB protection, which is, it's kind of a no-brainer. Then you don't have to worry so much. So anyway, that's my soapbox about sunscreen. I'll stop talking about that for now. So here we are with the EWG. I had mentioned them earlier in the presentation. And so to kind of recap, it's easy for me to sit here and say, well, here's how you take care of your skin, and you just go find yourself some products and get yourself a good esthetician, and then you're off to the ball game, so to speak. But there's a lot more to it, and I think part of it that most of us find overwhelming and difficult to manage is, how do I know what to buy? So again, we look to the professionals that we've chosen to talk to, whether that be at a store, in a dermatologist office, at a spa, whoever it is, and we are putting all of our faith in that person, that the products that they're recommending and that we're buying are not going to harm us in any way. Well, we actually can take matters into our own hands a little bit more, which is very empowering and a very easy thing to do. There is a group called the Environmental Working Group, EWG, and I consider them to be a major tool, kind of in our tool chest when it comes to taking care of our skin. Their span is much more robust than just skincare, but they do have an actual category within their information, which is called Skin Deep, and it is all about skincare. And so to tell you a little bit more about how they how they are defined, they're a nonprofit American activist group specializing in advocacy for consumers in areas such as toxic chemicals, drinking water, pollutants, and corporate accountability. It's a lot of big words. Boil it down. Basically, as it relates to this presentation today, you can download their app, which there's their app logo right there for you. You can download their app and you can go into that app whenever you are considering, if you're out and about and you're looking at products that are not professional grade products as far as skincare, you can go into the EWG app and look those products up, and it will tell you on a scale of 1 to 10, 1 being very safe, 10 being not so safe, how those products break down and rank in all types of different categories. Like if they have known carcinogens in them, or if they have ingredients in them that have been known to affect, let's just say, fertility, as a thought. It will share that with you, and it will rate them from 1 to 10. So, is that a foolproof way for you to decide what type of products you're going to buy or not? It's not. It's a very strong tool, and it's something that you can use in addition to anything else you may have heard of about a product. It's an additional way for you to make an educated decision that is better than not doing anything. So I'm a big proponent of just having the knowledge and knowing where to go to access that knowledge. So EWG is something that you should check out. Just, check out the app and play around in a little bit. And as it relates to skincare, again, it's called Skin Deep. That's the section on the app that is most helpful as it relates to what we're talking about today. So that's a great tool for taking care of your skin. So what are my first steps to healthier skin? I would say that getting a skin analysis is going to be a really helpful thing to do. So again, this is something that you want to do through a dermatologist. If you have a dermatology appointment, you have to be going for something else. Be a great opportunity to ask at that time if they could do a skin analysis for you. If you have an esthetician, a good esthetician can definitely do a skin analysis for you. You want to steer clear of beauty consultants that work in, places like Sephora, or other sort of department store environments, because they do not have any skincare knowledge unless they are also an esthetician and a beauty consultant. So get a skin analysis from somebody who actually has studied skin and understands it, so that you know what you're dealing with and what you're working with. That's the first step to understanding how to take care of your skin. Come up with a consistent program that you can commit to. So one of the biggest issues that I see is that people are not consistent with what they're doing. They'll go out and spend a good amount of money on products that somebody has told them will work for their skin. They're not sure why, but they believe that person because they like that person, which is human nature. And then they come back and maybe for a couple of weeks, maybe for a couple of months, are really good with taking care of their skin, but the consistency eventually starts to wane. There are lots and lots of times that I can think of where I'll see a client, and since the last time that I have seen them, I always make notes. And so between two appointments, which could be a month, it could be 6 weeks, things drastically change. Like the particular product they were using had been using for quite some time. All of a sudden someone told them about something different, so they switched, but they really haven't stayed on that new product for very long, and now they're looking at something else, but their skin's reacting badly and they don't know why. It's kind of dizzying also, because you've got to sort of break that down and look at how to keep it simple so that you can be consistent. So you have to have products you trust. You have to have just a few products, which if you are sensitive, you should only have a few products. And you have to be really consistent with those products. So we should all have a daily skincare routine. Some of us, most of us, will work with our skin twice a day. If your skin is incredibly sensitive and you can't tolerate it, then once a day is fine. It's better than nothing, but ideally it's twice a day. SPF, I'm just going to draw a hard line here. SPF really needs to be twice a day if you're out and about at a minimum. In a perfect world there, you're reapplying your SPF every 3 to 4 hours if you're outdoors. So SPF is in a place all of its own as we're talking about this simple daily routine that I'm asking you to commit to. But regardless, you're going to find what works best for you as far as whether your routine is once or twice a day. You're going to commit to it every day. And at the bottom there, I just put a little bit of a guideline because for everybody that might look different, but for the most part, the steps that we're looking at when we have sensitized skin or sensitive skin, you're going to cleanse your skin, you're going to treat your skin, you're going to moisturize your skin, and you're going to apply SPF, and that's it. Especially while you're going through cancer or cancer treatments and you're dealing with those effects. You want to keep it as simple as possible, but you want to be as consistent as possible. So cleansing, treating, moisturizing, SPF. So the product line is as important as the protocol, meaning how often you do it and what you do when you do it. But in my opinion, you're committing to a product line for sensitive skin. It's very, very important when you are sensitized or have sensitive skin that you're using products that are made for that. If at all possible, professional products that are vetted by the medical community. They're either backed in science or they've been created by a doctor. There are lots of fantastic products like that. You'll find most of them in your dermatologist's office or in an esthetician's office that deals with oncology or compromised skin issues. You want a product line that has excellent reviews. And again, I'm going to stress it, samples, because I hate to see people commit to and invest in products that they can't use. So samples are the best way to go. And always ask wherever you are, if you're entertaining purchasing a product, if they have samples available. So some frequently asked questions that I get. What are the most common skin issues you see when dealing with oncology clients? I would have to say number one is redness and sensitivity. Another one is rashes. There are lots and lots of people that come in with just random, garden variety rashes that have just popped up for no apparent reason. Obviously there is a reason, but we don't know that reason. That's usually for the medical team to decipher and share with us. But lots of people coming in with redness, lots of people coming in with rashes, people that come in and typically they are having some sort of what I would call flushing. So they'll come in and they're very, very red. Their skin is red, it's hot, it's tight, and they're not sure why that's happened or what's going on. in a lot of cases, I can't say certainly not for all, but in a lot of cases that is a chemotherapy-based response, and somebody has had treatment not that long ago, and it's causing flushing, which presents in the way that I just described. So that's a really common skin issue too. Another frequently asked question that I get, what's the difference between what I do and a traditional esthetician? So people basically say, why would I come to you instead of just going somewhere else? Whether you come to me or you go to another oncology certified esthetician, it's really important that you know that there's someone available for you if you are going through treatment, or even if you're out of treatment and you're still having reactions that first started when you were in treatment. It's really important that you know that there's somewhere you can go where the individual that's going to treat your skin understands what's happening. So I have a training and an advanced training and education in oncology aesthetics. Does that mean I know everything about cancer? Absolutely not. Do I know a really good amount about what cancer and cancer treatments do to the skin? Yes. Am I able to make modifications to keep you safe if you were to come and see me throughout the treatment and do no harm to your skin? Absolutely. So there are things like, if somebody has had surgery and they have a hard time laying on their back or laying in the traditional way that you would lay on an aesthetics table, we can do things like modify your positioning. We're aware of where you have ports and how to work around ports and lines and massage techniques that we can and can't do to keep you safe from swelling and edema. And if you're suffering from lymphedema, any kind of changes that we need to make or modifications to make sure that we don't do any damage in those areas. We understand what types of products we can and can't use based on what you're presenting with. And then hopefully we're able to detail out and give you a home care protocol that will keep you moving your skin in the right direction between the times that you come and see us. So a traditional esthetician knows about skin, but they don't know about cancer and the effects of cancer on the skin. And those are very, very important things. I'll give you one final example on that a lot of people don't think about, but if you are going through treatment, whatever type of treatment that may be for cancer, and it causes your skin to dry to the point where you might get microscopic tears in the skin, or they're also called fissures. That's a really important and big issue, because if you've got microscopic tears in your skin, that can invite infection into your body, and it can create enough trouble that your oncologist might say, hey, I'm sorry, we've got to stop your treatment for a little bit because we've got to get the skincare issue under control. So, I think people don't necessarily think about skincare from the standpoint of it being a really important component when you're dealing with cancer and cancer treatment. And I would just like to paint a little bit of a different picture and tell you that it is really important. And it's important that you keep your skin healthy and well so that it doesn't create complications for your cancer treatments. And oncology certified estheticians should understand that, whereas traditional estheticians do not have that training. So hopefully that's helpful with that explanation. Another commonly frequently asked question, of course, can you tell me what this reaction is on my skin? And again, I'll just reiterate, we cannot diagnose anything. And it is tough because there are so many times when I would like to say, yes, I believe I know what that is because I've seen it before a few times. But you have to stop short of saying that because that's outside of the scope of what estheticians do. So if you go to an esthetician who starts diagnosing anything, you need to just be very, very well aware that they are working outside of the scope of their license, because we don't diagnose anything. We treat based on a diagnosis that is made by a medical professional. So the answer to, can you tell me what this reaction is on my skin? No, I can't. I can tell you that it may look like something in particular, or that you know, may fall into a particular family of rashes or, you know, something fairly generic, but I'm always going to refer you back to your medical team and then ask you to come back and see me and let me know what they've told you. When is the best time to schedule a skincare service if you are in active treatment? If you are going to go and see an esthetician to have a skincare service, an oncology certified esthetician is going to want to know everything about your treatment plan as far as the scheduling, and the recommendation is going to be that, you know, obviously your counts are good, that your white cell counts are good, your red cell counts are good, and that you are coming, if at all possible, between treatments and not during a treatment. That's the best time to schedule a skincare treatment or service. Do I need authorization from my medical team for a skincare treatment? Yes, you do. And we actually, an esthetician, excuse me, should be able to make that process very seamless for you and very easy by faxing paperwork over to your doctor or medical team, to the nurse or whoever it is that handles permission to treat forms, and they should be able to get that taken care of for you so you don't have to worry about it at all. But yes, you would need an authorization to be treated. When do I need to contact my medical team regarding changes on my skin? I think I've already covered that. Anytime you have changes on your skin that you can't explain, contact them to find out what they are. Because again, keeping your skin intact and keeping that skin barrier healthy is important to the continuation of your treatment. So you don't want to ever have a stop in your treatment based on something that's gone wrong with your skin that you overlooked because you thought it was, you know, simple or something that didn't need to medical attention. So always better to be safe than sorry. We already talked about the environmental working groups, so I'm actually going to skip through that one. We touched on my products, which are Hale and Hush products, and I have a full line of products, and 9 particular products within that line are oncology approved, which means they're currently being used. So if you have any interest in knowing anything about those, please reach out and I'd be more than happy to get you samples. I have samples of all of them. I'm always happy to share samples. So kind of wrapping up here, there are alternate lines for products because one of the frequently asked questions I get is, what product should I use? So I try to keep my recommendations to a very short list. Obviously, I recommend my own product line that I carry. I did not create the line, but I consider it, I just refer to it as my line because that's all I have and all I choose to have. So Hale and Hush would be my #1 recommendation. And there are alternate lines like CeraVe and Elta MD that I am very familiar with through professionals like my own dermatologist and other dermatologists in the Austin area that I know have a lot of faith in those lines. So I would definitely recommend those as alternatives if you're looking for other professional grade lines. And so I'm wrapping up, coming to an end here, and I basically would like to just reiterate a few things, just so you know where to go with all of this information. #1, it's easy to take care of your skin. We make it much more complicated than it needs to be. We don't need a lot of products. We only need a few, but we need the right ones. We need to commit to a routine that we do every day. We need to be very aware of any changes that happen with our skin and, you know, write those down or make a phone call to somebody that you trust that is in a field where they can actually talk to you about what might be happening. And then just be aware of your skin in general and what type of skin you have and how it changes. So you've got a couple of things that I want you to take away today. I want you to think about, do you have a product line that you're comfortable with that meets what we talked about as far as being for compromised and sensitive skin, having few ingredients in each product, and something that you feel confident that you can get background information on and ingredient information if you need it. So do you have a product line? Do you have the few tools or access to the tools that we talked about? Can you commit to taking care of your skin? And do you know where to go when you have questions? So do you know that you can call your dermatologist, your oncologist, your medical team, an esthetician, or other professional that might be in your world? And so those are the important pieces. I hope that some of this information has been helpful. I realize it's been a lot, but I'm happy to answer questions always. I offer complimentary consultations for anybody who needs them. And I'm located in Austin at Cancer Rehab and Integrative Medicine. So I will say goodbye and thank you very much for listening and being part of this today.
All right, thank you guys so much. Let's go over, we've had some really great questions come up that I absolutely want to go over with Samantha. So Samantha, let's have you stop sharing your screen. And once you've done that, perfect. Okay, the very first question that's come up is so right now during this seminar, we're dealing with the COVID pandemic. And so when we're talking about seeing an esthetician, what do people need to keep in mind when it comes to safety and what to ask for when it comes to safety protocols when you see an esthetician? And what are your protocols and are you currently treating?
So let me see if my memory was good enough that I remembered all those in order. The first answer is yes, I am actually treating people and have been for about 6 weeks at this point. Protocols are going to differ based on obviously where you're going and the level or the quality of that environment. So I'll start with what we have available to us as estheticians to use. We have obviously masks, medical grade masks. We have face shields of all different types and styles. And we have gloves and we have the air purifying units that we can put in each room. There are all kinds of changes that have taken place now based on TDLR and their recommendations as far as how the treatment rooms are put together. Before, typically an aesthetics room would be a place where you would go, it would be very comfortable and cozy and lots of padding on the tables and whatnot. And now we have stripped the tables of all of the padding except what's actually necessary and can be changed between clients and can be sanitized between clients. So all of the comfy, cushy things that we used to have, unfortunately, we no longer have, but it's obviously for everybody's safety. And protocols as far as people coming in have changed. There are protocols where depending on where you go, you actually have to wait in your car and you have to text your practitioner and let them know that you've arrived. That practitioner lets you in and make sure that there are only a certain number of people that are in the facility at that time. That's for traffic control, obviously, and spacing, social distancing. And the same when you leave. And then, when everybody leaves or as each person leaves, there is a massive amount of disinfecting and sterilizing and cleaning that's going on with the room and anything that's been touched on the way in or out by either the practitioner or the client. So that's, with aesthetics, the difficult piece of it is we can't expect our clients to wear a mask. It is very difficult to do any kind of facial service with a mask on. So we assume the responsibility of protecting ourselves with the things that we have available to us. And the clients that I see have not been wearing masks at this time.
Thank you so much, Samantha. The next question is from Susan. So Zalota has caused her issues with hand and foot syndrome, but also general thinning of her skin, which is creating issues with bruising and bleeding. If you're off Zalota, does that last or go away, or is this going to be a constant issue?
So Susan, that is probably out of my scope of answering. What I can tell you is that unfortunately, it's usually not a consistent reaction with medications and individuals. It's very specific to the condition of their skin prior to being on the medication, factors that would include genetics, your age, all kinds of different things. So unfortunately, it's not a one size fits all for that. It just depends.
Thank you. And kind of along with that, Kim's question was, if she's having skin sensitivity right now during cancer treatment, how does she know when that skin sensitivity has resolved after treatment?
Typically, the sensitivity is going to present in a way that you would know that it's gone because it wouldn't present anymore. So let's just say your sensitivity was or is a rash, or it was excessive redness, or even hyperpigmentation or hypopigmentation somewhere. Those things would simply cease to exist if they were gone, I guess would be the right way to put that.
Thank you. Bob's question is about bruising, and he says that even the slightest pressure can cause massive bruising and take weeks to disappear. Are there any recommendations in terms of bruising?
Well, bruising is not typically a skin-related, from a standpoint of treating skin. It's not a skin-related issue. It's something a little bit more systemic and underlying with the tissue below the epidermis. So I don't have recommendations for that. That would definitely be a medical question.
Thank you. Are oncology aesthetic services covered by insurance?
They are not at this time, unfortunately, but I am more than happy to work with people, at least in my practice, on what they're able to do, and have been doing that for quite some time.
Thank you. And then Chelsea's question is, Chelsea is about to start radiation treatment, and so she is wondering, specifically to breast cancer treatment, what areas are areas that are most commonly irradiated, so she knows what area of the skin to prep for. And I have actually, since Chelsea posted this pretty early on in the presentation, I actually have an image that I'd like to share to just show the area where people can frequently have radiation with breast cancer treatment, if that's okay with you, Samantha.
Sure,
So
absolutely.
just give me one moment to share my screen. All right. So Chelsea, in general, and I'm Angela, and I'm the oncology physical therapist at Cancer Rehab and Integrative Medicine. And I do want to start by stating that where they do radiation treatment is very specific to your particular type of cancer, and where they need to treat is very individualized. However, if you can see the screen here, these are generally the areas for breast cancer treatment that they do irradiate. And sometimes they don't do radiation quite as much into the armpit, and sometimes they do, depending on lymph node involvement. But you can see that this is your collarbone right here, so they can do radiation above the collarbone, almost into the neck area, all the way down the sternum, sometimes even into the sternum midline area here, and then down towards the lower rib. Right here would be her lower rib and the armpit. And the actual radiation can and often does go through to the same area on the back. So although the skin changes aren't as significant in the back, they can go to the back shoulder blade area and on the side of the trunk too. So when you're prepping your skin, just keep in mind that that radiation will involve the front, the side of the trunk, even into the back as well. And I hope that that answers your question, Chelsea. Are there any other questions for Samantha before we end our seminar today? Go ahead and post them. We'll give you a couple more seconds. And then also know that Samantha's information is on our website under skincare services. So her email address is there if you have any specific questions for her, and her phone number too. So going once, guys, going twice. All right, we really appreciate you joining today. And please check out our upcoming seminars and our regular weekly exercise classes. We are here for you during this time in any way that you need. Thank you so much.